We're 1 minute to live. We're live on DPTV.
Welcome to the third COVID313 Community Coalition for Families and Students Teletown Hall. I'm Christine Bell, mother of 3 awesome children, honored to serve as the Executive Director of Urban Neighborhood Initiatives, member of 482 Forward, and co-host for today's Town Hall. Over the last 3 weeks, we have heard your concerns for your children, their education, especially those with individualized learning plans and English language learners. You have told us that you need information to ensure you can best support them while having to navigate these very challenging times. Our goal today is to bring you the experts that can give you the information you have been asking for to help you care for your families and yourself. So thank you for joining us. And we're going to get started in a few minutes. We are translating the town hall to Spanish, Arabic, and ASL. So we want to give folks time to get to the right line, on the right line, and get comfortable. Cindy, please share the phone number for Spanish translation.
Si necesita traducción en español, por favor, hable al 313-626-7440. 313-626-7440.
Saeed, please share the phone number for Arabic translation.
إذا كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030. Again, 313-241-7030. Thank you.
Katie, please share the instructions for ASL.
Thank you, Katie, and thank you, Christine. We're getting ready to get started, and welcome to those of you who have just joined us. I am Jametta Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network. I'm a Detroiter and a mother and grandmother. I'd like to tell you a little bit about what this wonderful coalition is that has come together in just 3 weeks. The COVID313 Community Coalition for Families and Youth is comprised of people just like you. We are organizers, change agents, parents. We come from faith-based organizations, community organizations, the City of Detroit, and foundations. And just like you, we're trying to figure out how we can provide resources and at the same time navigate these very trying times that the coronavirus has brought upon us. We know that families and students need information, facts, support, and resources. And that's why we're here, to help you stay safe and be healthy. And try to figure out how to juggle in this timeline of staying safe but distant and staying connected. We're so excited that you've joined us today and to be part of our third program. We want to hear from you. We want to hear your chats, your questions, and we have experts who can help you navigate again the trying times that we have with the coronavirus. But speaking of trying times, let me be real. This is an extremely difficult time for many of us. We're full of unanswered questions, fears, concerns, and many of us are being deeply, deeply affected in our city, our communities, our homes. We extend our condolences to all of our sisters and brothers who have lost someone, including people part of the coalition. We know and we feel our collective pain. And interestingly, in fact, we now see that there are more experts on the news and even this White House who are taking note of the disproportionate and high levels of deaths amongst African Americans. The deaths of our sisters and brothers are sadly shining a spotlight of the historic health disparities that impact Black, Brown, and poor people, wherever we are, whether it's Detroit, Chicago, rural Mississippi, or Kansas. All of our communities have been victimized with higher rates of environmental toxins, inadequate healthcare and education, and disinvestment versus economic development. These unresolved and historical disparities based upon race, ethnicity, and income require us to be diligent and combat these forces every day. That's why this coalition is with you. We are with you, and we are continuing the battle so that all of our children and families can thrive. As families, we know that this time is scary. We also know that we still have power. We have the power in our own hearts and our own homes to keep each other safe and be focused on being healthy, probably ever more than our history. Let us come together in that power. Let us come together and love on each other, stay informed, and so important, let's stay connected. Christine?
Thank you, Jametta. Yes, we need to stay connected and find our power both within ourselves and collectively in this time. The town hall format will begin with comments from our caring experts in their areas of expertise. Then you will have a chance to ask questions. Soon we'll hear from Dr. Rahman, Medical Director at the Detroit Department of Health, Randy Liepa, Wayne RESA, Superintendent, Dan Quisenberry, Executive Director of the Michigan Association of Public School Academies, Jeremiah White, Program Manager, Hope Starts Here, Victoria Kavari, Executive Director, Detroit 2020 Census Campaign, Mayor's Office, City of Detroit, Cindy Gamboa, Director of Organizing at Detroit Hispanic Development Corporation, Tara Hardy, Manager, Early Childhood Initiatives, Detroit Public Television, Reverend Larry Simmons, Executive Director of the Brightmoor Alliance, Joe McGuire, Housing Attorney at Detroit Justice Center, Maria Keha, Program Manager of Community Outreach at DTE, Crystal Hepburn, Team Lead, Children's Special Health Care Services, Detroit Health Department, Dominique Walker, Clinician with the Children's Center. I want to remind everyone who's not speaking to please turn off their cameras so that we can see our ASL interpreters. Stay with us for the next 2 hours so you can get your questions answered and stay informed at a time when each day brings new information. We also want to hear from you. Please use the chat on Facebook or text your questions to 313-288-2082. Again, that is 313-288-2082. We'll have Q&A after each segment. If we can't answer your questions today, we're committed to getting the answers to you by early next week. All questions today will be posted with the answers on COVID313.org. Cindy, please share the Spanish translation phone number for the folks that have just arrived.
Si necesitas traducción en español, por favor, habla al 313-626-7440. Hoy la señora Gloria Rosas y Liliana Torres harán la traducción.
Thank you, Cindy. Saeed, please share the number for Arabic translation for the folks that have just arrived.
إذا كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030 ونحن مستعدون لخدمتكم.
Thank you. Katie, please share the instructions for ASL. And to get us started again today, please welcome our Lisa Hurd.
Hi, thank you, Christine. Hello, my name is Arlisa Hurd, and I am an organizing member of 482 Forward, and my family and I reside in the Focus Hope neighborhood, also known as Hope Village. I am a first-time grandmother of a 5-month-old and a mother of 2 sons, both with special needs. One is an adult living with sickle cell anemia, and the other is an 8th grade student who is diagnosed with ADHD. I just want to be transparent for just a moment, if I could. You know, these last 2 weeks have been so very heavy. I'm sure most of us by now either know or know of someone who has died from the coronavirus. Just since last week's telethon, our teletown hall, the death toll in this city, in this state, has risen. And even more heartbreaking is the fact that many families and friends haven't been able to gather and to mourn their loved ones properly due to these social distancing restrictions. Seemingly overnight, our lives have been turned upside down. Businesses have closed, jobs have been lost, schools have closed their doors for the rest of the year. And people are wondering if they're next to contract the virus. Just like that, parents and families have gone from taking their kids to school to actually becoming the school at the kitchen table, learning algebra again with their 7th grader, or maybe even trying to help their special needs child get through a reading assignment. Some parents have to figure out childcare because they have to go to work. They can't take off. While others may have to balance working from home or maybe not working at all and then wondering where their next dollar is going to come from. You know, these teletown halls are important for all of these reasons. We know the burden is heavy. We know it. In fact, many of us are living it. But it is our hope that we can help you make that burden just a little bit easier, starting with today. So today, we're so excited to have participants on Detroit Public Television Facebook Live and onedetroitpbs.org. We want to be able to be a one-stop shop for you so that you can get answers to your questions and to know we are here for you and for each other. Next up, we have Cindy Gamboa. Cindy?
Thank you, Arlisa. And hi, everyone. I'm Cindy Gamboa. I am also a proud parent to 3 amazing children. I live in Southwest Detroit, and I have the honor to serve as the organizing director at Detroit Hispanic Development Corporation. I've also been participating in this amazing coalition, COVID313. As a reminder to folks that are just joining us, the COVID313 Community Coalition for Families and Students formed to ensure that everyone has regular information about what's happening during this crisis. The organizations and community leaders are going to be shown on the screen, all of the organizations. And we're grateful to have representation of all of these leaders from these organizations on this call today. This coalition is going to continue to deliver on the commitment we made a couple weeks ago to continue to support families in 2 ways. We're going to continue these live teletown halls every Thursday from 12 to 2 to bring you guys the most up-to-date information on topics that you're most interested in. We also will continue to compile all of the resources that come across our eyes onto one site. It's covid313.org. So just like Arlisa was saying, for me, dealing with this crisis, parenting my kids, grieving a family member, and so many loved members of our community has been extremely hard. I want to let you know out there that it's fine to just be not okay sometimes. These are very challenging, tough times for everybody. For me, it was a blessing to know that I had so many people to count on. And today on this call, we have experts that are going to be sharing ways to help you cope with what's happening as well and who to turn to. For our children, they'll also be struggling with a lot of things. The transition to online learning may be difficult, but rest assured there's people like us and you at home that will be continuing to fight to to ensure that all of our kids get the education that they deserve, even in these trying times. We want to ensure that the plans that are developed fit the needs of all of our students, regardless of where they're at. We have a growing number of English language learners, or ELL students, in Metro Detroit, and we want to ensure that these plans include ways that they're going to be able to be serviced. We're inviting all of our speakers today to tell us how they're going to ensure that all of our students, special education students, ELL students, are going to receive the education that they deserve. Before we begin to hear from our experts today, I want to share one very important action everyone out there can take right now, and that's to fill out your 2020 census. This is one action that for most people, it's going to take you less than 10 minutes, but it's going to impact our city for the next 10 years, especially in the areas of education, healthcare, food, and emergency services. And right now, all of these things are critical and lifelines for times of crisis. So please don't put it off. Spread the word. Participation in the census has never been easier. You can go online to my2020census.gov, call the toll-free number listed on the screen, or use the paper form that was mailed to you a few weeks back. So we have the Spanish and Arabic numbers on the screen as well, if you wanted to call the toll-free numbers. We have experts that are going to give us updates on other topics as well, around education, health, mental health, census. So stay tuned. They're going to be speaking from 12 to 2, and then we're going to have sporadic Q&A sections throughout the segments. And we're also, before we begin, we're going to have Arlisa share important information. Arlisa?
Thank you, Cindy. So if you are on Facebook Live, we have chat moderators that will answer questions and post questions on the Zoom for our panelists to answer. If you are watching from onedetroitpbs.org, you can text us questions to 313-288-2082. Again, text your questions to 313-288-2082. The rules of the chat are being posted now. We are committed as a group to posting the answer to questions that aren't answered early next week or on our partner Facebooks. We will also post a live recording of this on COVID313.org. If you would like to sign up for regular updates and to get reminders from our group, please sign up by filling out the form in the chat on Facebook or texting your email to 313-288-2082. Again, text your email to 313-288-2082. Now, for those of you who have just joined us, I will have Cindy, Syed, and Katie tell us again how to connect if you are a Spanish Arabic speaker or if you need ASL interpretation. So, Cindy, please share the number for Spanish translation.
Si necesita traducción en español, por favor, habla al 313-626-7440. 313-626-7440.
Thank you. And Syed, can you please share the number for the Arabic translation for folks that have just arrived?
إذا كنت بحاجة للترجمة إلى اللغة العربية، رجاء الاتصال على الرقم 313-241-7030. Thank you.
And Katie? Now I will turn it over to our moderators, Christine Bell and Jametta Lilly.
Thank you, Arlisa. We're really grateful for our panelists that could join us today. We have asked them to share with us the 3 to 5 most important pieces of information that families and students need to know right now to provide some peace of mind during this very incredibly difficult time. For our experts, please remember to speak slowly for our translators. They really want to make sure that they're translating the important information that you're giving correctly. Also, please turn off your camera when you are not speaking to ensure that our ASL interpreters can be seen. You will have 5 minutes to share. Terry Whitfield will chat you your remaining time, and if you go over your 5 minutes, I will gently remind you to wrap up. We will be taking questions from our guests at the end of each segment. Jametta?
Thank you, Christine. We are again moving forward, and if you have questions, you can type them into the Facebook live chat by texting 313-288-2082. Again, that's 313-288-2032. We have moderators for both the chats, and they will sort the information, as well as our translators will make sure that that information is translated. Now we're going to move into our expert voices. And as we're committed to do every time, is to bring you the voices from education. Our first speaker is going to be Superintendent Randy Liepa, who is the Superintendent of Wayne RESA, the Regional Education Services Administration. Randy, welcome. You have 5 minutes.
Can you hear me?
Yes, we can. Go
All
ahead,
right.
please.
It is great to be here, and I'm happy to provide an update about what's going on in the educational landscape right now, which is certainly unprecedented and nothing that we've ever seen before. And I would just highlight that as we move into this new era of education over the next few months for our students, that we know that the instruction that we're going to provide, at least over the next couple months, can never replace a classroom teacher working directly with the student. We know through research that this is the best way and the most impactful way to provide education and recognize that what we're going to be doing over the next couple months really is the very best we can do under very trying circumstances. And so I'll give you a picture of what are the biggest issues that school districts are working through right now as they're preparing to really, very honestly, reopen school, but school will be reopened in students' homes. And so that would be the best way to look at it. School has been physically shut down, but the executive order that was provided by Governor Whitmer clearly says that school will continue. And so we want to thank the governor for doing what we think is an excellent job of providing a guideline that we need in order to be successful in regards to meeting the needs of students. The uncertainty was the biggest struggle for local school districts, and now we have some certainty around how we're going to finish out the school year. And right now, school districts are remarkably busy preparing for that. And so just highlighting a few of the priority areas. Number one, every school district has to submit a continuity of learning plan to the intermediate school district and ultimately to the state that will identify how they're going to provide educational instruction over the next couple of months until the end of the normal school year. And so those plans will include a lot of good information. And by the way, every school district will have to post their plan once it's approved. They'll have to post that plan on their website so you can see every school district's plan or your school district's plan. I would also highlight that the plans have to be completed and this new instructional model has to be in place no later than April 28th. In most cases, I believe school districts, at least in Wayne County, will have their programs in place prior to April 28th. School districts are responsible to communicate to parents when that will happen. And so I think in a short period of time, you will be hearing about when that information, when your school will be starting back up and what that plan is. The plan highlights how instruction will be given at home. And we're going to see school districts using a variety of different methods to do this, from online to hard copy instructional packets, because we recognize that every home is different in regards to the resources that they have. And so their plan must include how every student will be able to access the learning lessons, and they'll have to make sure that they identify what that looks like. And so, is it English? Is it math? Is it going to be an instructional package? Is it an online class, etc.? Those are kinds of things that will be identified in every district's plan, including how they're going to support special education students, EL students, in every segment of the educational community. They'll deal with the highest issues that they're dealing with right now include grading, how they're working directly with their employees to make sure that their collective bargaining units are being honored, and at the same point in time, making sure that they're meeting the requirements of the state. Again, special education guidance is coming from the state in regards to how we're going to support our most vulnerable students at their homes. And they're also working through a variety of issues related to food distribution, how they're going to work with seniors who are graduating, prom, graduation, etc., and a variety of other issues related to, very frankly, funding, which is the last comment I'll make, and that is we are going to need support from the federal government to make sure that when tax revenues are down in Michigan, that we have the dollars that we need to continue programs for our kids. And so we're going to be pushing hard for that and looking for people to support us in that message. And my time is up, and I will take my cue from the moderator.
Randy, thank you so much. That was an abundance of information. And you know that this coalition and many in the community are absolutely behind the work of our educators to make sure that there's an equitable distribution for more resources for us to support our children, particularly in this timeline. We'd like to move forward and have Don Quisenberry, who is the Executive Director of the Michigan Association for Public School Academies, to speak. Welcome, Dan.
Jametta, thank you, and Christine, and all the hosts. I want to reference Arlissa and Cindy's opening comments. Know, please, that even though I don't live in the city of Detroit, we all know people here in Lansing or in Detroit that have this deadly virus and who have succumbed to it. So we share that mourning that everyone is going through. I also want to offer hope. It's amazing to watch, as Randy Liepa was just saying, how educators are pivoting and addressing the needs of our students and in our communities and families. So I want to get to our topic, the questions, appropriate questions that people have about special education and English language learners, and give some sense. I want to underscore what Randy just mentioned, that it was only a week ago on this call, the governor was announcing her executive orders and the continuity of learning plans, and schools have been very quick to dive into what that looks like. Some were prepared, and we're doing things already that will continue. Some schools not as prepared, and so they are working hard. And as Randy mentioned, by April 28th, all should be doing more than they were doing and delivering that and communicating what those plans look like. But special education specifically, it's going to have to take a different look than what it looks like in the building, but you still have social workers getting time with their students. You have IEPs being updated virtually. You have parapros getting students together in meetings online with other students to do breakout room types of activity. I'll talk a little bit more about this. With English language learner, the same kind of thing. I'm most familiar, obviously, with charter schools, particularly in the city of Detroit. So we assume that families and students have chosen schools that are already familiar with that language and culture. So all the things we're talking about in terms of delivering education should continue because they're familiar with that language. It'd just be interpreted. So there are packets and information that's available for them as well in their own language. But here too, we know that those are unique issues. And so online learning, video, virtual kind of things, educators working with parents may be the best way to deal with that. Here's some things I heard from an educator that I want to touch base with everybody, because again, so much of this is very complex. You should be hearing more from your schools, but I want to put some context around it. Everything people have said in these opening comments, we're all families, we're all parents, we're all working hard, so are teachers. So in all of this, compassion takes priority over compliance. We need to understand what people are dealing with, both the students and their families, but also the educators and their families. So everyone's acting in good faith to try to determine what's reasonable and appropriate, whether it's a student with an IEP, whether it's English language learners. So know that that's what everyone's working to do in delivering meaningful education and continuity of it, and yet understanding that sometimes those things are just not going to work as well. With special ed students, implementing those IEPs as best to the extent that's practical is important, looking that maybe there'll have to be some makeup when buildings can be opened up again and we can be back face to face. Here's another topic I would put for all education: general education, English language learners, special education. Schools will be working to monitor the progress kids are making or that schools are making with kids. A point, Jametta, I would want to the community to know is, because there's been so much misinformation, this matters. It counts. My fear would be that people start to dismiss this as not important. We certainly don't want to punish students that aren't able to access education, but we also don't want to punish kids by saying, well, I don't need to work hard at this. I don't need to engage. I don't need to respond. This matters. So it's a two-way street. The school should be communicating with you in the next few weeks about what they're doing and how they're doing it, and that learning should be starting. And it's important for families and students as best they can to engage so that we can keep learning going in this time frame. But I know I'm taking my time. I appreciate this opportunity to continue to be engaged and look forward to doing it more. And my heart goes out to everyone. And hang in there, we're doing this well. I'm just impressed with what educators are doing to respond.
Dan, thank you so much. And we are all looking forward to the communication and the engagement that our schools are going to provide for our parents, as they also are trying to juggle the dilemma of the digital divide that's impacting us. But there's another population that we need to hear from when we think about our education continuum, and that is to hear from the voice of early learning. And we're so pleased to have next Jeremiah White, who is the Implementation Success Manager for the Hope Starts Here initiative. Jeremiah, welcome. You have 5 minutes.
Thank you, Jametta, and good afternoon, everyone. Dan, Randy, thank you for your wonderful insights and context. It's great to stay connected to the things that are happening across the field of education. As stated, my name is Jeremiah White. I am the Implementation Success Manager of Hope Starts Here, and I'm delighted to be on this call and provide you all some of these critical updates during such an important time for our community of children and families. Hope Starts Here was born out of the belief that Detroit won't reach its full potential until our kids reach theirs. And we're talking about all of them. And so the first 8 years provide that critical window of opportunity to change children's lives and our communities for the better. So Hope Starts Here is essentially the citywide community engagement and activation process, and it's dedicated to supporting the healthy and comprehensive development of children pre-birth to age 8. So now the shifting conditions and evolving understanding of who and what is at risk is resulting in significant fear and anxiety. And with preparation and preventative measures and adherence to the national and state public health authority recommendations, we can work together to keep our community safe during these trying times. For Hope Starts Here, in our initial COVID-19 call to action response phase, Hope Starts Here was able to produce online digital hope kits with tools and other resources to address various ways to manage stress for adults and children. We are proactively supporting adult-child resiliency, and we also provide information on local resources for families who are in need of additional targeted supports. So right now, if you were to visit our website at hopestartsheredetroit.org, you will find resources such as how to prioritize self-care for parents and caregivers during COVID-19, or psychological tips for children and adolescents' emotions, even additional web and online resources for DPS CD students with exceptional learning needs, such as speech and language needs for the deaf of hard and hearing needs, or even visual impairment needs. Sorry, my screen just adjusted. Give me 1 second.
We can hear you fine, though.
Okay, perfect. Well, I will keep going. So additionally, last fall, aside from those needs of the Hope Kit, please get onto hopestartsheredetroit.org and go to our COVID-19 resource section, where you'll find links to all of those resources. But in addition, last fall, we began sort of our deep implementation and coordination of practices across our partners in the city, such as the City of Detroit, the COVID313 team, United Way of Southeastern Michigan, as well as Wayne, RESA, Skillman, 482 Forward, just to name a few, to ensure that we are providing the best information for families and early childhood providers during this crisis. And there are a few things happening across this ecosystem of partners that may be helpful for families for me to lift during my time. First being that Hope Starts Here is partnering with Living Arts to host several mindfulness Facebook Live sessions or other social media posts several times each week, as well as we are partnering with Behavioral Frontiers and the Color of Autism to offer quick 1 to 3 minute videos on social media for families supporting children with special needs. To learn more about either of these, you can follow us on Facebook at Hope Starts Here Detroit, or you can tap in directly to our partners at Living Arts or Behavioral Frontiers and the Color of Autism. Last few comments that I wanted to add before I relieve my time is we know that the federal government has some forthcoming stimulus packages that will include an increase for funding for childcare. We also know that Michigan has not yet received this money, but we know that the state is working on a plan to quickly use this money to support families and childcare providers. So we've connected with the state, and they've identified 2 goals for this funding, the first of which being to ensure that essential workers have access to affordable childcare during the crisis, but 2, to ensure that the sector remains a vibrant part of our communities and that childcare providers reopen after the crisis. So it is with these in mind that Hope Starts Here is actively partnering with funders across the system to support the basic needs of families of young children. We are actively advocating for families, children, and caregivers and childcare programs at the local, state, and federal program. We are actively partnering to coordinate childcare supports for essential workers and working to increase the capacity of childcare programs to be prepared for children when adults return to work. So in closing, as a partnership that engages families, businesses, educators, health experts, and the larger Detroit community, Hope Starts Here will continue to support systems level change for our community of children and families. And we know that despite this uncertainty, Detroit is still very much strong and resilient. And the hope that we all share does start here. So please share this information with all of your loved ones. Please stay positive and stay safe. And thank you. I will look to the chat if there are any questions, and we'll do our best to make sure that those questions are addressed. Thank you so much.
Yeah, thank you, Jeremiah. As you said, hope starts here. So now we'll take about 5 to 10 minutes for questions and answers. Again, if you have questions for this segment, you may use the Facebook Live chat and text 313-288-2082. Again, that's 313-288-2082. I'm going to turn it over to Christine if we have any questions.
Oh, yes, we have questions.
Okay.
Thanks, Jametta. There is a person that asked a question about resources for people to be able to do their laundry. We will find the answer to that question. So look for that to be posted next week, because I think that's an incredibly important question. So thank you for it. So the first question, and I think this, Dan and Randy, if you could speak to this. My question is regarding K-12 students who are experiencing disciplinary action at school, such as suspension or expulsion, when the stay-at-home order was issued. Will these students be able to be included and allowed to resume a virtual education, passing on to the next grade, graduation, etc.? Will they be recognized as being deserving of an education in this moment, or will these young people continue to be invisible and pushed out? And the person says, all children matter. So could Dan or Randy speak to that?
I'm happy to talk about the specifics of the order and how it relates to that. And so the order does not directly speak to students that were either suspended or expelled. And so the guidance that's been provided, really, that would be a local school district decision. I'm making the assumption that if their suspension would have been lifted during this period of time moving forward, that those students would then be expected to be part, again, of the student body and would be learning with their classmates at home through the regular processes. For those that would have been expelled, there's no specific different rule now that goes into place for students in that regard, and that would be the teams. They'd have to look to the same types of resources that they were trying to garner prior to the closure. Of course, even that much more challenging, and so it's a good item for me to remind superintendents about. That, let's not forget about these kids, and do you have a plan for them? So it's a great point.
Thank you. Dan, is there anything you'd like to add?
No, Christine, I thought Randy did a nice job of referencing it, but I want to highlight what he was saying. It is a district by district decision. Their education does matter, and you would make the assumption, parents should make the assumption that the schools are working to include those students. So if they're not hearing communication, they should reach out to the school, find out what is happening and how they can engage. If they're uncomfortable doing that or they're not getting a response, again, communicating with the different organizations on this call would be important. So let's not assume that nothing should be happening. And as Randy said, it's a great reminder to all of us to make sure we're paying attention to that as the plans move forward.
Thank you both. And maybe providing districts with some guidance around that might be helpful in this time. So thank you both. Randy, this question is for you. What are schools doing to re-engage youth who were chronically absent before the stay-at-home order?
Well, I think that's going to be a significant challenge once again. But what school districts have identified is that they're making a commitment to do outreach to every single student. And so in some cases, that may be through teacher contact by email, by some other online resource. It may be a telephone call. It would be, obviously they're not going to go to the home. They can't do that. But everything short of that, there's going to be a re-emphasized effort by school districts, and it actually has to be part of their plan about how they're going to reach out to every single student. And so the plans or the conversation, at least that have occurred to date, really focuses on school districts, teachers, and other staff in the building doing regular outreach. And they'll identify, is that weekly, is that bi-weekly, is that once every other day? But they're going to identify particular touch points with students and families throughout this process. And so it's actually an opportunity to sort of re-engage at a much deeper level. People, teachers are used to having the kids coming in and engaging with them every day. And so this is going to be a push out and an outreach, maybe even stronger than we have at other times for those that are chronically absent.
Thank you, Randy. And I think this is both for Dan and Randy, and maybe Jeremiah could also speak to this. How do we ensure that this is happening so the question really is around IEPs. And so someone from the Ann Arbor Public School District, their understanding is that all the IEPs have been canceled in their district. So could you speak a little bit to that?
I can speak specifically to what districts are doing, and I know Dan did a really nice job earlier talking about from a big picture standpoint, so Dan certainly jump in. But from a district standpoint, school districts cannot ignore IEPs. They are not allowed to do this just because school has been closed. And so while we're still waiting for guidance in regards to exactly how IEPs can be handled, and I think Dan talked a little bit about that, the IEPs have to continue. And so, and that's, the IEPs that are coming up for either reevaluation or the first IEPs. So what I'm aware of school districts are doing is they're completing the IEPs that have begun. And so maybe where there's some confusion is there are potentially others that have not started their IEP yet, to where they, excuse me, they have not identified a date, or they have not identified a time, and they're waiting to see more guidance in regards to how potentially to do that. And so it's not that they've been canceled, it's just that they're waiting for guidance in regards to when to do that. So if they were in progress, they're continuing. If they weren't in progress, there may be a wait for some guidance, but they have to still follow all the federal rules, the timelines, and the guidelines until they're changed either by Michigan Department of Education or by the federal government. So school districts are very focused on IEPs and how they're going to complete them. They're concerned because they can do IEPs online, but there are some evaluation components of the IEP sometimes they cannot do online. And so they're trying to figure that piece out. But I want to be clear, school districts are still required to do IEPs. There's been no cancellation, carte blanche of IEPs.
And how are they going to be monitored? So how are you going to monitor once the school districts have put together their plans? How do you monitor that the work is actually getting done?
Just as we do now, we have monitoring processes on current IEPs, and so those will continue to be followed. And Dan, I want to let you jump in with any other thoughts you might have on that.
No, Randy, I appreciate everything you said and wanted to highlight it. Again, don't want to speak to a specific district, but perhaps the cancellation was, as Randy referred to, school districts were as confused as all those. Wait a second, we need to pause, get clarification on what we're supposed to do. Others began to implement distance support immediately. So maybe this was a case where the district said, we're stopping for the moment and figuring out what's going on. But yeah, it's required. And yet flexibility being granted to do what's reasonable and appropriate and doable at home at a distance. So I gave some examples of that, but so there are some things that can be done. Communication through phones or through the internet. Sometimes it's not going to be possible with a particular student or with a particular IEP requirement. Those things are going to be monitored, so schools will be documenting that, or should be documenting not only the engagement but the services that they're able to provide. And then at some point, then compensatory services will have to be provided or will need to be provided to make up for some of that, you would imagine. Again, I know this isn't, if I was a parent of a special needs student, none of this would be very satisfying to me. But doing nothing is not satisfying either. So doing the best that we can in good faith, with a reasonable effort to do the best we can to meet those needs is where we're working at. And yeah, schools are working hard to try to figure the best out.
And Christine, if I could just jump in with a follow-up question, particularly since we're looking at education in this continuum across age groups. So we're talking about IEPs, but there are also actually thousands of young children who have IFSPs, individualized family service plans, and those children very often, unfortunately, go into special ed. Could either of you speak to how IFSPs are being addressed, particularly in the pre-K programs, or Jeremiah, if you might have some information on that really quickly before we move out of this segment?
I'll let Jeremiah, if he has a comment on that, he might be best suited.
Yes, no, I've noted this question down. I think it's a very valuable question, but it may be one that I'd have to circle back to answer. I don't have any information equipped today.
Okay, great. Thank you. Christine?
Thanks,
Matt, I would
Jametta.
only comment,
Go ahead.
excuse me, Christine. Yeah, I don't have a specific thing to enlighten it further, but I do want to hit something we've talked about throughout this, and I know it's an additional responsibility for parents. Communicate, communicate, communicate. The schools are going to be, need to be, should be communicating with you. If you're not hearing from them, if you have questions, they need to hear what those obstacles are. They need to know that. And if the school isn't responding, you should be reaching out to someone else. So please do communicate. We hope that applies to even the students that were chronically absent. If the school has your contact information, this may be a better moment. I mean, let's be optimistic to find them, to talk to them, to engage them. So communicate, communicate, communicate.
Thank you, Dan, and we will have you on again next week. So thank you so much to Jeremiah, Dan, and Randy for their time today. If we didn't get to your question, please remember that we'll answer it. Also, there are Dr. Vitti did a live question and answer session that was student led, and some of these questions around chronic absenteeism and suspension and some of the other topics that were raised today, he answered questions. It's on YouTube, and we are going to post it in the chat if folks would like to take a look at that. Jametta?
Yes, thank you, Christine, and thank all of you for talking about our education segment. As was mentioned earlier, we're in a very important timeline, which is that we all need to make sure that our schools and our community get the resources that they need, and the census is such a critical part of that. To talk to us about the census will be Victoria Kovari, who is the Executive Director of Detroit 2020 Census Campaign, the Mayor's Office, City of Detroit. Welcome, Victoria.
Thank you. Happy to be here. So I'm just going to give folks a quick update on where we're at in the census, why it's important. I'm hoping I can share my screen here with this PowerPoint, just to give you an idea of where we are and what we're doing. As you can believe, we have had to really switch our campaign from a lot of canvassing, in-person events. We had over 90 events planned for March, April, and May at senior apartment buildings, at schools, at churches. All of that went away. And we're now in a position to have to do most of that virtual and find other ways in which we can use our communications, digital media, and other virtual events to contact people. So I just to remind folks about what the census is. Most of you know this, so I won't really spend too much time on this. The important thing to remember is people tend to think that maybe the census isn't important right now because they're dealing with so many other literally life and death situations. But healthcare, food assistance, the school lunch program that's so critical for a lot of families right now, and even the medical equipment in the national stockpile, it's funding that's all distributed based on population. And that population is determined by the census. So in these times, the census is more critical than ever. In addition to our political representation being critical as well, the census information is confidential. Most of you know that personal information you put on a census form is not shared with anyone for 72 years. The other thing, the census has been extended to at least mid-August. So before we were supposed to end the census, the site was supposed to go down at the end of July. They've extended that at least 2 weeks and are likely to extend it at least through the end of August. Again, there may be some misinformation that the census is somehow tied to you getting a stimulus check. That is not correct. The census has nothing to do with the stimulus check or any other kind of financial incentive. So important things to remember about filling out the form if you talk to people about this. One form is sent to each address, and you're required to use the address where you're actually staying, even if it's different than the one on your license. So this is particularly important for college students and others who might not be at campus. You're still required to use the address where you would have been going to school as of April 1. Even if you're using your licenses in Southfield or Commerce Township or Allen Park, whatever, the census requires you to use the address where you actually stay. Everybody in the house is counted, even if there's multiple families living under one roof. Some people don't necessarily want to list every single person if there's a lot of people living in the house. As long as you put the total number of people living there and you provide some basic information, you don't necessarily have to list everybody who's living in the house, even though it's important that you do for the historical records of everybody living there. But your census will still be accepted if you don't answer every single one of the questions. The other thing is just some facts about filling out the form. Most of Detroit got paper forms as well as an internet code. If you have not responded, the census is sending out, beginning yesterday, paper forms to everyone. And so everyone will be getting a paper form who has not submitted their census form. The important thing is you do not need a code to fill out the form online. My2020census.gov, you get up there, it'll ask you if you have your code, but if you do not have a census ID code, all you have to do is click that particular link on the census and it'll take you to some additional questions. So it's very easy to fill out, even if you don't have a code. Just to give you a little idea of what the response rate is looking like now in Detroit, Michigan overall, the response rate is 53%. They rank 3rd in the country for the highest response rate, so that's great. Detroit's response rate is only 38%, which we can do better. Compared to the national response rate of 46%, we're not doing that badly, but we still want to increase our response rate. Just to give you an idea of the areas in the city with the lowest response rate, the Woodward Corridor, the East Jefferson Corridor, East Gratiot from 6 to 7 Mile, Brightmoor, and Southwest Detroit, particularly 48204, 09, and 10. It's mostly West Verner to West Warren, along Livernois, just east and west of Livernois. So we really need to focus on those neighborhoods as well to try to increase the count. So some of the things we're asking folks to do is go on social media and hold your census envelope up or whatever and take a picture and blast it out to your followers or those on Instagram or Twitter and talk about how important it is in this particular time that so much of the funding we depend on for emergency services and healthcare depends on the census. So we're really asking folks to send that out over social media.
And Vicki, if we may, you can depend on us that we're certainly going to be a vehicle to support the city and all of us working to get this information out. So please excuse me just for a moment for kind of jumping in, but we do need to move forward. We have another speaker on the same topic to continue to reinforce this. And thank you for the slide. We want everyone to please take a moment, capture this information, and it will be available after the program. Would you, on this last slide, can you direct us for where you would like for us to call?
Okay, so they can email me. I can send them the script for phone calls or whatever at kovariv@detroitmi.gov.
Okay, great. Thank you so much. Also to reinforce the information that important information Vicki was providing us, we have Cindy Gamboa, who is the Director of Organizing at the Detroit Hispanic Development Corporation and is also a member of the coalition. Cindy, welcome.
Thank you, Jametta, and thank you, Vicki, for that important information. It's very critical, and I really did want to just emphasize how important the census is. Right now, it is critical that we get this right. We know that every 10 years, the census is doing this count, and it was written in the Constitution that way, right? It was written in a way where we have to have a complete count of everyone that's living in the country so that we can disperse all of the resources according to the population size. And that's also to include like representation, political representation. So I think right now, one of the things I do want to emphasize is that we're losing out on a lot of money for our communities if the people outside that are listening to this are not completing the census. I know in the last census, we lost almost $1 million because children under 5 were not counted. So people underestimate, maybe leaving off a couple people, maybe our cousin that is just crashing on our couch, or we have somebody that's living in our basement. Like everybody that is in your household should be counted. I know in Detroit we have a lot of families that live together in the same household, maybe have special living arrangements, but it's very critical that we count every person. I know Vicki has this in her slide because I learned this directly from Vicki, but for each Detroiter that does not fill out the census, we're losing $5,500 every year for the next 10 years. So this is for critical programs like SNAP, WIC, Head Start program, Pell funding for higher education. We have a lot of our families rely on free lunch programs, and that it's funded by federal funds from the census. We have $14 billion from Title I that's trying to be allocated according to population size for our schools, money for special education. So the money that goes into our public schools is going to be determined by the census counts. And I don't know about you guys, but for me personally, my 7th grader has books that are older than him. So I know that our schools are in deep need for more resources. So I'm asking you guys, I know it sounds like yet another to-do or something that you feel that is not going to benefit you, but it really does. It benefits all of us when you complete the census. If you are not completing it, that's going to hurt our community. We already know that we're struggling financially in the city, and we don't want to further there's huge economic inequalities that already exist. Mm-hmm. But we want everybody out there to do their part. We cannot afford to lose one more dollar. We want to make sure that we get our fair share. So everyone out there, please do your part. Talk to your family members, everybody in your community, and tell them how important it is. If they need help figuring it out, please offer them, a list of resources. There's community organizations that are doing amazing work out there. Follow us on social media. There's different organizations that are doing work. The city of Detroit has an amazing website that will kind of guide you through that process. But there's 3 ways. Vicki talked about it. You can fill out the paper form and then just mail it back in. If that's the way you want to do it, that's great. For the first time, it's going to be available online, so people can go onto my 2020census.gov. And then there's toll-free numbers that people can call and get information, complete the census in the language that they prefer. So I'll leave it there, but I just want to emphasize that you're not doing this for the government, you're doing this for your own community, because our community deserves their fair share of resources. So please go out and fill out your census.
Thank you, Cindy. And thank you, Vicki. We want to pause for a moment to see if we might have some questions about this important piece of paper, but really opportunities, power that our community needs to get the resources to help take care of ourselves. Do we have any questions?
We do. Vicki, has there been a push to extend the count beyond August under the circumstances?
There's been some noise about it, but there's nothing official. Right now, they've suspended their operations that will do the door knocking operations until mid-June. And they've like I said, the census will be live until mid-August. So they're likely to extend them beyond mid-August, but we don't have any indication about how long that will be.
Is there anything, Vicki, that the city of Detroit is doing to advocate for the extension?
No, we're not. We've been asked to sort of like chill out about that, frankly, from our national partners, because one thing that the Census Bureau right now has gone down to a bare bones operation. So the number of paper forms, which 40% of Detroiters have submitted paper forms, unlike any other city in the country. And they've just barely, they're barely counting the paper forms now. So, you know, we're kind of waiting for them to come up and frankly get their stuff together about this stuff and give us some more clarity about what's going to happen. Because we would still like to get canvassers on the street, but we don't want them to be on the street when the Census Bureau door knockers are on the street. But a lot of things are up in the air, and they're trying to do workarounds a bunch of different operations right now.
And Vicki, I just want to give you one more chance to tell us what we can do to make sure that we're all counted, if there was something that was missed in your segment.
Well, I think right now we're doing a 20 for 20 campaign. Make 20 phone calls for the 2020 census to your neighbors, your friends, your family, and ask them if they filled out the form. Tell them to go online. If they don't, if they can't go online, those phone numbers that Cindy put on the slide earlier, call on that. They're in 12 different languages, including Arabic and Spanish. But mostly we've got to get our internet response rate up to that. And like I said, the Census Bureau is sending paper forms out now to everyone who has not submitted any form. So there'll be another chance for people to do that. But the 20 for 20 calls are really important. We're also starting a virtual phone bank in the next few days, where we'll be literally calling 100,000 phone numbers and reminding people to fill out the census. But everybody can call 20 of their neighbors in the city of Detroit and encourage them to fill out the form.
Thank you, Vicki, and thank you, Cindy, for sharing with us what we can do to make sure that we are all counted. Thank you. Jametta?
Yes, thank you again. And speaking of things that families can do and parents, we've talked a great deal about the stress that we know that this circumstance has created in so many different ways. So now we're going to transition to a section to talk about parenting tips. And our very first speaker is going to be the Reverend Larry Simmons, who is the Executive Director of the Bright More Alliance. Reverend Simmons, welcome.
Hello. Can you hear me?
Yes, we can hear you.
Okay. Molly will have to unmute my video because you can't see me. Molly?
It's unmuted. You should have access to video now, Reverend Simmons.
Okay. So we are going to flow with it.
That's right.
We said we would.
We can hear you well.
That's a wonderful thing. So listen, I want everybody right now, if you would, wherever you are, can you hear me?
Yes.
Oh, good. I want everybody, wherever you are, just to take a minute right now and take a deep breath. Again, take a deep breath. And now I want you to lift your arms and I want you to shake them. I want you to shake your head. If you can't lift your arms, shake your head. That's it. Come on, Jametta, Cindy, come on, everybody. Help me. Move those arms, move those legs. Shake that thing. Come on, move what your mama gave you. Come on, now move it. Now stop. You just experienced the power of stop and go. And I want you to know today that this is one of the most important gifts of power that you have, to stop when you need to stop and to go when you need to go. This is Holy Week for those of us who are Christian. And our leader, Jesus, was once asked, what's the most important scripture in the Bible? And he said, the first and great commandment is to love the Lord your God with all your heart and with all your soul. But he said the second is like unto it, and that is you should love your neighbor as you love yourself. And so I just want you to know that you have permission from on high to love yourself so you can love your neighbor. Listen, you can't see me, but the thing that makes me really unique to this group is I'm the only one you can shine a light on my head and get a reflection back. I'm old. I am, in fact, 73. I am older than 90% of the entire population of the United States. And I have done and seen some things, but I have never seen anything quite like this. And that's because there never has been. In the recorded history of humanity, there hasn't been. And so you are inventing things that your children and your children's children will have to deal with, will learn from. I'm also the parent of a special needs now adult. My oldest son, who's 50, is a special needs person. And I'm telling you, I know what it is. When you are taking care of a special needs child, you hear all of this jargon, continuity of learning, targeted, ecosystem, advocating, engaging, mitigation. Listen, when I was a parent of my son, and that little sucker was running around the house, bouncing off of every wall, mitigation was the furthest thing from my mind. I want you to know that you have the power to stop and to go. Sometimes you have to stop trying to get your child to learn and just let them go and you go. I want you to take time, as we were told, to love yourself so that you can love him or her, so that you can do those things that we know our children who have special needs can do. You can love your child in this situation, but you know, and I know, drinking out of this fire hose of information that everybody is pouring on us can be overwhelming. I just want you to know that COVID313 and all of our partner organizations are here to help you. We are a resource for you. You can call us, you can send a letter to us, you can email us. And if you can't, and we can't do anything else, we'll be there with you. We plead with you. Take the time to love yourself. And don't remember, you can stop and you can go. It's time for me to stop so we can go to my good friend, Tara Hardy. Tara, you're up.
Hello, I'm Tara Hardy. I manage the education work for Detroit Public Television. And I agree with the Reverend. Parenting is hard. Parenting is extremely hard during a pandemic. And there is no such thing as a perfect parent. Please give yourself grace. At DPTV, it is our mission to support, elevate, and engage the adults that surround the child. Teachers and parents are the silent heroes through all of this. DPTV is here for you. We have designed daily teacher-approved activities for preschool all the way through 12th grade. We have also created messaging to support parents during this time with messages like how to talk to your child during this time. And it is okay to not be okay. You can receive texts, join us on social media and web, and broadcast support, all from us. We are working with this group and other partners to really figure out your needs as parents and your needs as teachers. We will be sharing information in the next week about how to connect from our website, dptv.org/education, hopestartshere.org, and the COVID313.org site. You can also follow me, Tara, at Detroit Public Television on Facebook. We would like to take a few minutes for you to have a chance to share some topics that we may not have covered yet or you need more resources for. I would ask that you do that in the chat or in the Facebook chat or the texting at this time. Thank you.
Thank you.
And Reverend Larry, we can see you now. Welcome.
Get that go going.
That's right. Christine, do we have any questions for this really important hearing from both Tara as well as Reverend Simmons on parenting tips?
Not at the moment. Hopefully everybody didn't go.
Stop going.
And this might be a good place to share that one of the things the coalition is committed to do is not only our once a week 2-hour engagement like we have today, but with different partners, we're going to be doing a deeper dive into information. So we're really looking forward to having a deeper dive with Detroit Public TV. Hope Starts Here, as we begin to say, what do we need to do as a community and families to better support pregnant families all the way up to the age of 8? So both Tara and Reverend Simmons, thank you so much. And thanks for helping us move a little bit.
That's right.
Yeah. We're going to move forward in our program, because actually what you talked about and prepped for us is that we have to be mindful of our mental and spiritual health as much as we are our physical health. And many of us will know and understand that indeed our physical health is really more of a symptom or outcome of the spiritual and mental health that we have. And to help us to talk about that and think about that, we're so pleased to start off with a message from our Detroit Health Department. We have Dr. Najiba Rahman, please excuse pronunciation, who is the medical director of the Detroit Health Department. We welcome you. And we also are going to welcome Crystal Hepburn, who is the lead for Children's Special Healthcare Services with DHD. Please join us.
Good afternoon, everyone. Can you hear me?
Yes, we can. Welcome.
Okay, yay. This is my first webinar, so I'm excited. Yeah, so thank you for the invite. I'm really looking forward to hearing your feedback and what we can do. You know, this is a really difficult time for everybody, and I know that the quarantine is probably very challenging and not knowing what to do and how safe you are, but you know, the more we can just keep you all indoors and at home, spending time with your family, hopefully not going outdoors too much. If you need to get a walk in or do something for wellness, you know, please do that. But I know that many of you are still working, and so there are still some restrictions from like the CDC and the state health department on who can get tested. We have a lot of testing available in Southeast Michigan, but what we want is to make sure that you know that the priority right now is for individuals that are in nursing homes or in congregate settings like in homeless shelters or getting dialysis, hospital workers as well, anyone with underlying health conditions, and then essential workers that have to be reporting. So like those are like our first responders. So all of those individuals have to have symptoms to get tested. So the city of Detroit has we just started doing rapid testing, so we can get results back in 15 minutes. So again, it's mostly for first responders because we want to make sure that they can be back at work. So we're getting pretty quick turnaround because we had a lot of the police department that was on quarantine for up to the 14 days. But now that we have rapid testing, if they're negative, then they can return to work. So that's helped relieve a lot of the anxiety of our first responders and our healthcare workers as well. So just to go over some of the numbers for the city of Detroit, it's unfortunate we've had 5,834 cases as of yesterday, and we've had 247 deaths. And what we really want to focus on right now is those congregate care settings, so those nursing homes and the dialysis centers and homeless shelters. So just a little bit on what we're doing to address the outbreak. So we have about 27 nursing homes that exclude long-term care facilities in the city of Detroit. And we've reached out to most of them at this point. Actually, we've reached out to all of them, but we've had cluster outbreaks in about half of them. And so as of yesterday, we've started to do testing. With that rapid testing that we have available, we have a team that goes out and we test anybody that has symptoms. And we're also offering the same for staff so that staff don't have anxiety and fear. So either they'll come back negative and they can return to work using the proper PPE that we're always talking about, or they're to stay at home until approved to return to work either by their physician, or they could call me as well. Additionally, we have a homeless quarantine shelter. So if somebody is showing any signs or symptoms of COVID in a regular shelter in which they're staying, we have nurses that go out 3 days a week. We do temperature checks, we ask for symptoms, and if they fit the criteria, they get sent to our quarantine shelter. It's a really wonderful place. People are being treated so well. We have the best staff of the nurses and security. It's a really happy environment. So I know that the word homeless quarantine shelter sounds intimidating, but it's a great operation, and it was really built by maybe 6 or 7 people. And they deserve a lot of credit for what they've done, because they're putting a lot in without very many resources. So of those other shelters, we're starting to find some clusters as well. So, we're coming up with a strategy now as well to start going into those shelters to do point of care testing. And so we've organized some teams that take a City of Detroit vehicle. We have all of our swabs ready, and then we just we get everybody's names together, and we just go out and swab, and then we get the results back the same night. So these are some of the areas we're focusing on now. So if we can get the community to just, really, really stay indoors and practice social responsibility, even if you're healthy, that doesn't mean that everybody else is. And so we want to make sure that nobody is spreading the virus, because we don't know for sure if you can spread it without showing symptoms, but it's probably likely. That's the case with a lot of viruses. So we want to make sure that our elderly population is especially protected. So just some of the numbers that we've been looking at. So for the City of Detroit, about 43% of cases have been in men, about 52% in women, and then about 4% in gender neutral categories. About 42% of the cases have been in individuals over 60, and 58% in individuals between 20 and 60. So compared to China, we're seeing numbers in a younger population, and there's a lot of concern about why that's happening in Detroit. It's also happening in Southeast Michigan, where we have a different demographic profile, but a lot of my concern is the underlying comorbidities in the City of Detroit. So that just means like people that have other health conditions like obesity, blood pressure, diabetes, things like that. We have really, really low numbers in individuals under 19. Just like in China, they had about 1 to 2% of cases in individuals under 19. We're seeing the same thing, but we still have to be careful because we don't know if children can spread it asymptomatically. And also for the death rate, just comparing to other cities and jurisdictions. So for every 100,000 people that live in the City of Detroit, we're seeing 37 deaths. And that's unfortunate, it's very high. And we need to keep working on community mitigation as much as we can. So we need you all to work with us. That's in comparison to New York City, which is experiencing 51 deaths per 100,000 people. Wayne and Oakland County are seeing 18 and 19 with that same ratio. So we're double what Oakland and Wayne are experiencing. And that's about it for right now. But if you have any questions, also if anybody is employed and they need to get tested, they can call our phone number at 313-876-4000. So what we want is for people to first go to their primary care and try to get a prescription to get tested at the state fairgrounds. That's probably the easiest place to get tested quickly. And if you can't get through with your primary care doctor, then you can call this 313-876-4000 number, and they will direct you to some of our federally qualified health centers that can also do testing.
Dr. Ruckman, thank you so very much. And thank you for reminding folks that the Detroit Health Department is here with that telephone number 876-4000, and that there are fairly qualified health clinics in our community, particularly for those who do not have a primary care physician. And also, we'd like to welcome, if Crystal Hepburn has any other information from the Detroit Health Department, please feel free to make remarks as well.
Oh, hi. Good afternoon. Thank you for having us again, and thank you to Dr. Redmond. She went ahead and went through everything. The only thing that I would like to go ahead and make sure that we add to this week from last week's presentation would be to encourage everyone to go ahead and wear a mask. CDC has changed the guidelines for individuals, whether they are symptomatic or asymptomatic, don't show any signs or symptoms. Anytime individuals are in the public, we do recommend you wear a mask, just in case. Other than that, I believe that we went over much of the details in regards to the testing site, groceries last week. If anybody has any questions, we'd be happy to take them.
Okay. Thank you. We are going to hit pause right now to take questions. Christine.
Hi, everyone. Again, we do have some questions here. So the first is testing accessible in Spanish and in Arabic and other languages?
So I believe that our line does have Spanish, Arabic, and there's one other language.
Bengali?
Yeah.
Great. And then there's a question about why are there parts of the city, such as Southwest Detroit, not showing up as having many cases?
Yeah, so interestingly, my epidemiologist and I looked at the numbers yesterday, and we found that the cases are less than 5%. So what I'm suspecting is that people are just not getting tested for whatever barriers are posed. And so I'm in the process of talking to Wayne State University about mobile outreach strategies. That's kind of the next phase. We have sites where people can come to us, but we need to start going into the neighborhoods. And we realize that's a challenge. And I was really happy that I got to speak to Lisette yesterday or the day before to really underscore what the need is, because we're in the thick of this pandemic, so we really need the community to call us out on things that we're missing. And so I welcome anything from any of you at any time to improve what we can do. But yeah, so that should be rolling out. We're starting to have conversations with Wayne State right now.
Great. Well, I think Southwest is a place that definitely needs more testing areas, but I'm sure there are other parts of the city as well, particularly places where testing is low cost or no cost.
Yeah, so testing is actually free everywhere. I don't think anybody is charging insurance right now. So that's really
What
good.
about folks without insurance? Could you say a little bit more? Because it's our understanding that there is a charge if you don't have insurance.
So there's not a charge if you have insurance. So I know the state fairgrounds, it was initially like promoted for people that had insurance, but we also like addressed because we got questions of like, what about the uninsured and underinsured? But we're still going to just like eat the cost for it because we just need to make sure people are tested.
Great, thank you. The city website tracking COVID case is the city's website tracking COVID cases by race. It lists the largest number as unknown race. Is this where Latinos are being counted?
So the reporting is, it's a little bit difficult because, we started with having a communicable disease team of 2.5 people, and we've ramped up to, I believe it's around 25 now. But every time a case comes in, we have to follow up with that. So if the hospital or the state or whomever is doing the reporting is not putting in ethnicity or race, then it's just not being tracked. And so that's one of the barriers for sure. One thing that we could realistically do is start looking at ethnicity and race for the mortality data. We can grasp that a little bit better, but it is going to be a challenge to go into some like 2,000 or 3,000 cases at this point to figure out what the ethnicity is going to be. But it's still telling. I mean, it's, you still have a predominantly African-American population, and so it's probably not off by that much. But I am requesting for the nursing homes and the homeless shelters to indicate ethnicity so that we have really, really good tracking for congregate settings.
Thank you. And this is a bit of a repeat question, but I do think it is important. So why are some testing sites charging uninsured people for office visit and the test? Shouldn't the test be free?
So people are being charged at an office visit, so that is more a decision from the clinic's side.
Okay.
That wouldn't be the health department, because what we're offering to first responders and everybody that fits into the criteria, it's free. But I think for the clinics too, they still have to operate. You know, some of the federally qualified health centers are at risk of losing their funding by the feds, you know, in upcoming months, so they still have to operate. But a lot of times they should be able to waive that fee for uninsured. So that's surprising.
So are you just speaking to federally funded clinics? Because I think these questions are more broad to other testing sites like urgent cares and things and sites like that. Another question has just come in that says some clinics are charging $100 to $200 to be assessed. Could you speak to this?
Yeah, so I would probably go to a federally qualified health center. I think that, you know, it caters to uninsured, underinsured, and always has. That's the history. I would not pay $100 to $200 to get an assessment over telehealth. That's, can I say unethical? I don't know.
Yeah. I mean, you know your ethics, so
that's my own opinion.
Okay.
I think everybody should have equal access to testing. There's a lot of anxiety in the community, and even if you just have a cold or a sore throat, you know, I've seen cases of people that have abdominal pain. I've seen cases of people that just have a scratchy throat and they end up positive. So I think people should have access.
And so can you just confirm that all of our federally qualified clinics are doing testing at this time?
So all of them have agreed to partner with the state fairgrounds, but they still have to go through the assessment with the FQHC, and they still have to fit into the priority groups that have been outlined by the state health department. And so we really want to stress that, because we don't want the FQHCs to lose patients or for patients to get frustrated at the providers. You know, we want to be protective of the providers because they are, you know, some of like our community heroes.
Yes.
And for anyone who would like to find where the federally qualified health center is in their area, on the Detroit Health Department's website, we do have the interactive district map, which will go ahead and identify those. So I've gone ahead and put a link on in the chat section, as well as I've put the information about the City of Detroit's transportation to the state fairgrounds for $2.
Great, thank you. And then for our folks that are monitoring chats on Facebook and over text, could you please pull that number out of the Zoom chat and put it into the other ways that we're communicating with people? Just one more question. Is the city giving out masks? If not, where can people get a mask now that it's recommended to wear them? What kind of mask should everyday people wear?
Well, that's a tough one. I did hear that the city of Detroit is providing masks for everybody that works for DDOT, which I think is a wonderful thing, again, for essential staff that are out there every day. The city or the health department and city of Detroit are not giving them out to the public as far as I know, because we have to preserve it for the essential workers. So, you know, really any sort of protection is good protection. If it is a cloth mask, use it. If you have a surgical mask and you have a cloth mask you can wear over it, that's better. Some people don't have that, so a bandana or a shirt, whatever it is, or a scarf, you know, the more the better. Because, you know, it's a virus that is highly transmissible. It may not cause severe symptoms in a lot of people, but it spreads like wildfire. So the more layers, the better.
Thank you both so much for all that you're doing to help to combat the virus. Jametta?
Yes, thank you, Christine. So we're going to continue our health segment by bringing in Dominique Walker, who is a clinician with the Children's Center, which is one of the mental health agencies throughout the Detroit-Wayne County community. Welcome, Dominique.
Hi, thank you. Thank you all so much for having me. My name is Dominique Walker. I'm a clinical supervisor at the Children's Center. I've been asked to share some tips for parents and how to assist children who may be grieving or who may have experienced some loss during this time. And so one of the things we have to think about is this is new for all of us, and it's as if somebody took a pop bottle and shook it up, and that's how a lot of us are feeling on the inside. One of the things I would say as a number one is patience, tolerance, and reassurance. Be patient with the kiddo. Just as it's new to us, it's new to them. And they're trying to figure out how to work this out. The second thing, be honest as you can. Oftentimes, depending on your culture or how you've been raised, you may use words like crossed over or passed on. This is the time to be realistic and honest. It's okay to use words such as dead, death, or died. We know that that does help the grieving process. Also, don't hide your tears. If you're feeling upset or you're feeling mad or angry, please share that. Let your children see that and talk with them about what is causing that feeling. The third thing, a lot of times we'll fall into the pitfall of taking away the daily routine, allowing them to get off track. We want to keep daily expectations clear. And we want to make sure that those routines continue. There's some comfort in having expectations and knowing what's to come during your day. So if they're doing chores, please allow them to continue to do the chores. And if you all don't have a routine, maybe pick a few things that you can do during the day that will give them some happiness, okay? The fourth thing, share your story. If there are times when you've been angry, or you've been upset, or maybe you've experienced a loss close to you, share that. Help them to see how you were able to make it through. And it may give you a point of connection with your kid, especially if you're starting to isolate or having symptoms like nightmares or, other things like that. Connecting with them and sharing those stories may give them with you. Number 5, be creative. Please allow them to share their feelings as they feel they need to. A lot of people will come up with rituals to help during the grief and loss process. That can look like lighting candles or planting flowers or doing some of the favorite things of that person that they've lost, watching movies or listening to music. But don't shy away from the fact that you have lost someone and that your child is hurt about it. And the last but not least, take care of yourself. You have to take care of yourself mentally, physically, and emotionally. So if that's eating a well-balanced breakfast or just going out for a walk, please continue to take care of yourself. Parenting is hard, it is not easy, and we don't have a manual. So if you or your family are continuing to have any issues, you all can reach us at the Children's Center. We care. That number is 313-262-1212, or you can reach out to Detroit Wayne Access at 1-800-241-4949.
Dominique, thank you so much, because we are recognizing that we have families and children who are grieving. We have families and children who have special needs and who have in fact been receiving mental health services. So these may be topics that, again, if you have questions, to please feel free to put that into the chat or either text that information in to us. Christine, do we have any further questions?
Not at this time.
Okay.
Moderators,
all right.
Moderators, do we have anything? Looks like we can go on, Jametta.
Okay. So again, thank you so much for our health segment. Consistent with taking care of ourselves is to think about housing. which is really important during this time period because we know there's a number of issues with the economic instability and uncertainty that's going on now. So to help us really think about and understand housing and maintaining a safe home environment, really pleased to have join us Joe McGuire, who is the housing attorney at the Detroit Justice Center. Welcome, Joe.
Thank you. Thank you for inviting me on this call and this town hall. It's been really informative. I've been learning some stuff myself. So just to get right to it, the first thing I would encourage people to do if they have questions about a lot of different legal issues and how they are affected by coronavirus is to go to a website called michiganlegalhelp.org. And they have a really helpful page, which is just michiganlegalhelp.org/coronavirus. And that has a lot of the information I'm going to talk about, as well as other information about things other than housing. And so I'm just going to share the most important changes to housing-related law that have been implemented since coronavirus. The first thing is that the Wayne County Treasurer is withholding all properties from the property tax foreclosure petition this year. That means that properties and houses that normally would be foreclosed on and given to the county this year are not going to be. It doesn't mean that you don't have to pay your property taxes, and it doesn't mean that late fees and interest aren't going to be charged. It just means that for this year at least, the county isn't going to take those properties through foreclosure. The second thing people should know is if you have a mortgage during this time and you're worried about making your mortgage payment, you may be entitled to relief. The federal government passed what was called the CARES Act, and that has protections for people with federally backed mortgages. And I'm sure you're thinking, well, how do I find out if my mortgage is federally backed? Well, there's a few different ways to do that. It's not always obvious. You might not know that your mortgage is federally backed. About half of all mortgages are. So you can use websites. I encourage people to go to the Consumer Financial Protection Bureau's website. If you Google Consumer Financial Protection Bureau mortgage relief, their page on this should pop up, and it's very helpful. You can ask your mortgage service if your mortgage is federally backed. Your mortgage servicer is whatever company you normally communicate with and pay your mortgage payments to. You can use websites like knowyouroptions.com/loan lookup. And so different ways a mortgage can be federally backed is if your mortgage is a Fannie Mae backed loan, a Freddie Mac backed loan, an FHA loan, a HUD mortgage, or a VA loan, like a Veterans Administration mortgage. So if your mortgage is covered by this, the protections you're entitled to are that your lender or loan servicer may not foreclose on you until May 17th, 2020. Even if they've started the foreclosure process, they have to put it on hold until at least May 17th, 2020. The second protection is that if you experience financial hardship during the coronavirus pandemic and due to the pandemic, you have a right to request forbearance for up to 180 days, which is about 6 months. And you can request one extension of that forbearance for another 180 days or another 6 months. You must contact your loan servicer to request the forbearance. There will be no additional late fees or penalties or added interest during the forbearance period if you get it. What a forbearance period means is that you just don't have to make those payments during those months. It doesn't mean that any amount of your loan is forgiven or anything like that. It just means that during that time, you do not have to make your regular payments. And so the next thing to know is if you are a tenant in any kind of federally subsidized housing, and that can be a Section 8 voucher, HUD-funded public housing, HUD housing for seniors or people with disabilities, or low-income housing tax credit, or that's often called LIHTC housing, you are entitled to some protections. There's a moratorium period on evictions that the federal government has implemented for that housing until July 25th, 2020. And here's the thing that a lot of people don't know about is that this also applies to if you're a tenant in housing that has a mortgage that is backed by the federal government. Just like we talked about earlier, if your landlord has one of those mortgages, like a Freddie Mac or Fannie Mae loan, then you are entitled to these very same protections. And how do you find out if your landlord has a federally backed mortgage? You should ask your landlord. If your landlord tries to file an eviction case against you, the judge should, if you bring it up, the judge should compel the landlord to tell you, and thus covered by these protections. So what are the protections if you're a tenant in this housing? The landlord may not file new eviction cases for non-payment of rent during this moratorium period until 25th. It does not cover eviction cases that were already filed before this was implemented. Landlords may not charge late fees during this moratorium period. And the landlord cannot evict a tenant for non-payment during this period. They have to wait until after the moratorium period ends and then give 30 days notice. The exceptions are, it does not cover cases where the reason for the eviction is something other than non-payment, like any other kind of breach of the lease. And for a very helpful guide for this is the National Housing Law Project, or the NHLP, has put out a very helpful guide on the CARES Act, the eviction moratorium. So I would Google that. So let's say you're a tenant and you are not covered by those protections. You are not in a federally subsidized home, and you're not a Section 8 tenant or any kind of federally subsidized tenant. There is, for all tenants and people under land contracts and any other kind of residential housing agreement, a eviction moratorium that the governor implemented until at least April 17th. It goes through April 17th. It might get extended, so I would check on that. This covers all residential housing, except where the tenant, vendee, or person holding under them poses a substantial risk to another person or imminent and severe risk to property. That's the only exception. This was implemented in the governor's executive order 2020-19, so you can look that up yourself. It doesn't mean that tenants don't have to pay rent. It doesn't mean that landlords can't charge late fees during this time, but you can make some kind of arrangement with your landlord. Your landlord can always choose to allow you to hold back on rent, or forgive any kind of late fees, or put a rent freeze on them if the landlord so chooses. My general advice to people is talk to your fellow tenants and neighbors. Obviously not in person, but there's other ways you can do it through the phone or the internet. If you are so inclined, start organizations, start a tenant union. This is a great time to do that, and you can do that virtually. You can start a neighborhood mutual aid group with your neighbors, and seek legal advice. Be proactive. Information is your friend right now. And places where you can seek legal advice is on michiganlegalhelp.org. That you can. That's kind of a do-it-yourself website. But there's also organizations such as the United Community Housing Coalition out of Detroit, Michigan Legal Services, which is also out of Detroit, Lakeshore Legal Aid, which operates in a lot of different areas, including Detroit and Southeast Michigan, the Legal Aid and Defender Association, which is also has an office in downtown Detroit, and I think some other locations. And then there's a group called Detroit Eviction Defense, which is an activist mutual aid group. My final thing to tell people is to contact your representatives and the governor's office and really encourage them to expand these protections and extend these protections. Because I think we all know that a lot of people are suffering severe financial hardship because of this, and probably more people are going to suffer that going forward. So these protections are really, I think, important for the economy and our neighborhoods and the health of our communities. And so they really need to be extended and expanded to include as many people as possible to avoid people being evicted during this time.
Thank you, Joe.
Yeah.
Thank you. We appreciate that. So there are two questions. Oh, why don't we first go to DTE? But there are two questions for you. Jametta?
Okay. Yes. Thank you. So our next speaker, and we have a couple of questions. Our next speaker is Dana Williams Howard, and she is the manager of customer strategy, and she is managing the low-income DTE, and Maria Kalesia, program manager of community outreach at DTE. So I want to welcome both Dana as well as Maria from DTE. Please go ahead.
Thank you very much. My name is Dana Williams Howard, but I am going to let Marifer start first and then answer any questions that you may have for me. Marifer?
Wonderful, Dana. Good afternoon. So again, my name is Maria Calleja, and people in the community also know me as Marifer Calleja. As you heard previously, today with me is Dana Williams Howard, and she is the manager for customer strategy at DTE Energy for low-income programs. My role at DTE Energy is within the Department of Public Affairs, and I focus on community outreach. And I want to start by thanking Christine Bell for this opportunity and to commend all the organizers for launching this virtual town hall. DTE Energy remains committed to providing safe and reliable energy for all. We're working around the clock to ensure safe and reliable electricity and natural gas for all of our customers. And we do understand the challenges brought forth by COVID-19. We understand that each case is unique and it deserves from us a personalized attention. So this is why I want to ask you and everybody, please, to call us at DTE at 1-800-477-4747. Again, the phone number is 1-800-477-4747. We understand circumstances have changed for many of us and very quickly. Please call us and share your unique situation. Whether you are a low-income customer or you lost your job or you have been sick, DTE Energy wants to hear from you. This number, 1-800-477-4747, will connect you to a customer service expert and offer all the assistance that you may need. I would like to highlight that this phone number allows you to access an interpretation service that will translate your conversation. Interpretations are offered in several languages that include Spanish and Arabic. Again, DTE remains committed to provide safe and reliable energy for all of its customers while we all navigate together through the COVID-19 time. This is why DTE is working with government to provide funding to assist our low-income customers, and we're also designing flexible pay programs as are proactively assisting customers with their needs. Each customer is unique, and we would appreciate hearing from you. Also, we welcome your questions. DTE Energy is here to help. Please remember to stay healthy by washing your hands often, using a face mask whenever you have to leave your home, and most importantly, stay home. We've heard this throughout the day. A good reminder is that we can reduce our energy consumption by being mindful and turning off lights in rooms that we're not using, as well as televisions or phone chargers or other devices that are not in use. So please remember that DTE is here to help. Once more, thank you for having us on, and I invite you to reach out to us at 1-800-477-4747. We will be happy to answer your specific questions and address your unique needs. So thank you again very, very much, and we are open for questions.
Okay, thank you, Marifer. So I'm going to go back to the rental questions. While we understand that there's a moratorium on eviction, meaning people cannot get evicted right now, but does that mean people shouldn't pay rent? What are the consequences if someone doesn't pay rent while the moratorium is in place?
So the answer to that is in two parts. One, if you're covered by the federal protections, that means if you are in federally subsidized housing or you are in a house that or a property that is covered by a mortgage that is federally backed, then you do still owe the rent, but late fees should not accrue during this time. And your landlord cannot evict you during this time until July 25th for non-payment of rent. So it does not forgive the rent. You still will have to pay it eventually. As far as it goes now, who knows what kind of legal protections will come down the pike eventually. But yes, I mean, your rent will still accrue. If you are in housing that is not covered by those federal protections, then you are protected from eviction through April 17th. But you still do owe the rent, and there are no protections against late fees being charged for that time either. And so if you can pay the rent, or even if you can't pay the rent, what I would encourage people to do is contact their landlord and try to work something out with them. Because keep in mind, a lot of landlords are going to have a hard time finding new tenants right now, right? Because of the economy. And so tenants have some leverage right now to negotiate with their landlord and say, well, we can't pay you the full amount of rent, but we can pay you this much. And I would encourage tenants to investigate their landlord's own financial obligations, because if your landlord doesn't have to worry about property tax foreclosure right now because they're in Wayne County, and if they have a mortgage that is covered by this federal moratorium, then the landlord's financial obligations that they normally would have to pay are suspended right now as well. So it could be a logical ask from their tenants to say, well, if your financial obligations are suspended, then how about we suspend mine as well? And I would encourage tenants to organize as much as they can with other tenants, because obviously if one person goes to their landlord and says, can I get a break this month? That's one. But if 10 of the landlord's tenants come together and say, can we have a break? Then it's a little bit more powerful.
Thank you, Joe. And so the final question I want to ask is, so many folks are having to pick and choose what bills they can pay right now because of the financial hardship. So could DTE speak to if someone is picking and choosing what DTE is currently doing to help families that are unable to pay their utilities right now?
So I'll take that over. This is Dana Williams Howard. And so one of the things that, hi, how are you? One of the things that we are understanding is that this is a pandemic and people are not going to be able to pay. They're either going to get laid off, they're going to lose their job, unfortunately. They may get a reduction in pay or a furlough. So one of the things that Mayor mentioned is that it's important that when our customers experience an opportunity where they cannot pay their bills, to make sure to call that 800 number that Mayor Farr gave. We are designed to help these customers to get some type of energy assistance. So we really want teams to reach out, people to reach out, because everybody's circumstance is unique. And we want to make sure we get the appropriate expert to help and make sure that they'll be able to pay their utility bill.
Great, thank you, Jametta. We are done with questions.
All right, thank you.
Thanks.
Okay, so to all of our presenters and experts, we just can't let you know how much we appreciate you and your participation and your commitment to our children and families. And so with that, we're winding down our program, and I'm going to hand it back to Christine.
Thank you, Jametta. So again, thank you to all of our panelists, and thank you to everyone that has joined us today. If your question wasn't answered, we are committed to getting the answers and posting them next week on COVID313.org. And I want to thank our timekeeper, Terry Whitfield, because we are only 2 minutes from 1:55 when we were supposed to wrap up. So again, we're doing these town halls every Thursday from 12 to 2 to bring you the most up-to-date information that we can. Please sign up for regular updates by filling out the form in your chat. It should be there right now, or put your email or phone number in the chat on Facebook, or you can text us at 313-288-2082. Again, that number to text is 313-288-2082. Before you go, we're posting a survey on in the chat on Facebook. Please take a minute to fill it out and tell us how we're doing and what you would like to know more about. And I want to share one small but very important action that everyone can take right now to help our city and its people. please fill out your 2020 census. This one action will take most people about 10 minutes, but it'll impact our city for the next 10 years, especially in the areas of education, healthcare, food, and emergency services. And we all know right now how critical those things are in a crisis. Please spread the word to your friends and family. To participate in the census has never been easier. So up on the screen, you'll see where you can go. You can go online to my2020census.gov or call the toll-free number that's up on your screen right now, or you can use the paper form. And we just heard earlier in our session that if you somehow threw out your paper form, as I've been throwing out mail, and others I'm sure have been too, another paper form will be sent to you. You can fill it out that way. There is also Spanish and Arabic translation, and those numbers are on the screen as well. We also really want to hear from you about what you want to hear next week. What type of topics or by texting 313-288-2082. And again, we want to hear what you are interested in hearing about. Although these times are really hard, we can find strength and power in each other. And as a community, we are here for you and each other. Everyone have a really great rest of the week.